Health insurance in the United States has a distinct reputation. For the average person, the system is toxic, intensely expensive, and suffocatingly complicated. Behind the scenes, the barriers to entry are just as punishing. Building a health insurance provider requires massive upfront capital reserves and the ability to survive a labyrinth of state and federal regulations. This timeline tracks new business growth across a 15-year period. While tech startups were exploding in almost every other sector, the access for new health insurance companies in New York State remained completely flatlined. 0 new providers successfully launched. That changed in late 2012. A new tech-centric provider entered the market with the specific goal of changing how consumers expect their insurers to behave. Facing a market this stagnant required a specific combination of skills, a bridge between high finance, data science, and the regulatory labyrinth of healthcare. Joshua Kushner grew up in a New Jersey immigrant family. Watching his father build a real estate business, he absorbed a relentless work ethic, one focused on working both smart and hard. At Harvard College, he moved quickly into entrepreneurship. He launched a pop culture publication that flopped, and then co-founded Vostu, a Latin American social network. After graduation, he pivoted into high finance. He spent a year at Goldman Sachs, cutting his teeth in the private equity arm, managing distressed debt. He eventually took that financial experience and launched his own venture capital firm, Thrive Capital. By securing a position as the second-largest investor in Instagram's early funding rounds, he proved his ability to spot massively profitable tech opportunities. Getting a health insurance startup off the ground requires an immense amount of money and strategic agility. Kushner brought the venture capital, the startup grit, and the financial network required to even entertain the idea. The next piece of the puzzle came from Mario Schlosser. Originally from Germany, Schlosser had a direct window into clinical care through his mother and sister, who both worked as pediatric nurses. While his family was doing hands-on patient work in the clinic, Schlosser chose a very different path: computer science. He developed a core operating philosophy that quantitative data is the ultimate tool for finding systematic ways to understand and eventually optimize complex real-world systems. By filtering clinical care through the lens of computer science, Schlosser treated insurance as a data optimization project, focusing on systematic ways to help members find more efficient paths to health. But building a data-driven system isn't enough in a heavily regulated industry. You need someone to bridge complex technology with public policy. Kevin Nazemi laid the groundwork for this role at the Massachusetts Institute of Technology. Over the next 15 years, he built a career intensely focused on using technology to improve the actual delivery of healthcare to patients. Kushner had the capital, Schlosser had the data architecture, Nazemi provided the structural industry expertise required to survive the labyrinth of healthcare regulations without being immediately shut down. The geographical convergence point for these 3 distinct minds was Harvard Business School, where they attended classes together. In 2012, Schlosser and his wife were expecting their first child. They found themselves caught in a claustrophobic nightmare of opaque medical bills, confusing forms, and endless red tape while trying to navigate her pregnancy. Schlosser realized that the incumbent insurance companies possessed massive amounts of patient data, yet they did absolutely nothing to use that information on behalf of the member to simplify their care. The experience highlighted a massive disconnect. An industry that treats patients as numerical data points on a spreadsheet rather than partners in a healthcare journey. Around this same time, a massive macroeconomic shift collided with their personal frustrations: the passage of the Affordable Care Act. Traditionally, insurers were entirely optimized for business-to-business pipelines, selling strictly to employers. The ACA created a brand new individual marketplace, forcing health plans to begin selling directly to consumers, a shift that caught legacy companies completely off guard. Seeing this opening, Kushner, Schlosser, and Nazemi merged their venture, data, and policy expertise. In late 2012, they officially incorporated their own direct-to-consumer insurance company. They needed the brand to stand in stark contrast to the sterile legacy providers. They chose the name Oscar, borrowed from Kushner's great-grandfather, specifically to ensure the company sounded approachable, personal, and human. The company was the product of 3 smart minds, but it was also a perfectly timed response to a legislative shift. It was a highly calculated bet that a dreaded financial necessity could actually function as a clean, consumer-friendly tech service.